My name is Ibrahim. I am a physician by training. I'm also a historian of psychiatry and migration. I recently finished my PhD from the University of Glasgow, and I'm still sort of formally attached to the university as the Charlotte Nicholson Postdoctoral Fellow in History. But my day job is practicing medicine, so I am a foundation doctor in Sheffield teaching hospitals in the UK, with a plan to specialize in psychiatry starting from next year. My presentation looks at the history of the practice of psychiatry in refugee camps and in sort of situations of medical humanitarian emergencies. A bit more broadly, it looks at the field that may be called sort of refugee mental health. It started out more as a bit of an intellectual history, but it's also very much a history of psychiatric practice. I'm interested in how the theories and the ideas and concepts behind psychiatry and its different therapeutic orientations have been articulated according to the socio-political contexts and contingencies that govern and structure forced migration. And for the purposes of this conference, my presentation concentrates on on how the issue of culture or cultural difference has been engaged with by psychiatrists working with refugees and migrants. And one of the points I made is that transcultural psychiatry is just one way among many that psychiatrists working with refugees have engaged with the issue of cultural difference. There are other modalities which are not called transcultural psychiatry, but they do not ignore culture. They just have a different conceptualization of culture, and that's what I talked about. My own kind of interest in this research began when, in 2011, during the Arab Spring, when many Syrian refugees began arriving in Egypt, which is where I'm from. And it was then that I initially began getting interested in psychiatric practice with refugees, and it was impossible to ignore the fact that the most common and the most prevalent sort of clinical paradigm for understanding refugees' mental health was trauma. And then very quickly I came across what were seen to be critiques of trauma as an idea, as kind of a contextually inappropriate idea. And from there, I sort of got it. I did some work in Egypt when I was doing my master's in the American University in Cairo, and I did some work with sort of some research work with Sudanese refugees in a sort of a small community in Cairo, where I looked at their experience, where I particularly at a kind of therapeutic modality called narrative exposure therapy, but then which aims to deal with the idea and the symptoms of trauma. But from there, I got more interested in, well, how did the field sort of arrive at the current state? And I realized very quickly that there is no sort of comprehensive history of psychiatry's interest in refugees, the way there is, for example, a history of psychiatry's work in the military, of which, for example, we have a whole century to draw on. And sort of, yeah, realizing that gap, I became interested in how and when psychiatry first became interested in refugees and forced migrants as a sort of special patient population. I think I bring a new perspective to transcultural psychiatry. So my PhD was sort of an interdisciplinary project that was based partly at the College of Arts and partly at the College of Social Sciences. So so part of my PhD was the history of medicine aspect, but the other was the sort of refugee studies or refugee history aspect. And so it's the refugee history aspect that I think brings something new to the study of transcultural psychiatry. Because through refugee studies and studying refugee history, we learned that the figure of the refugee in the 20th and 21st century is constituted differently from any other migrant, not because it's an essential category or an identity, but because there are certain socio-political contingencies that have led the refugee to be constituted differently from other migrants. And that in turn has led the figure of the refugee to be conceptualized and constituted in a very contingent and shifting and changing way by the psychiatrists who have worked with refugees. And so I think that studying kind of like looking at the history of psychiatric work with refugees, it tells us not only about the different ways in which culture has been conceptualized and approached, but also how the very figure of the patient has been has been conceived of. I mean, the most personal reason was probably that I find it interesting and fascinating. But in terms of a more wider relevance, I think kind of like my perspective, sort of as someone trained in medicine and trained in sort of in public health, and then now bringing the interdisciplinary perspective from the humanities and social sciences, I'm really interested in how kind of learning about the history and the development of transcultural psychiatry and more broadly sort of ideas and approaches from the medical humanities. I'm very interested in how that can on the one hand sort of lead to the development sort of new theories and concepts in clinical psychiatry, and lead to the improvement of the improvement of patient care basically. I am often asked at every place that I give a conference or that I attend a conference and give a presentation, why are you not doing research on your own country? Why are you not doing research on Egypt? I think that that question reveals a lot of assumptions, but my response to that question is usually that Western scholars are not asked why they're not sticking to their own country. Whereas scholars from the global south are often implicitly assumed to their contribution is implicitly assumed to be that they are just bringing in uh, the information. They are translating a kind of like or globalizing local knowledge in non-Western languages into. No, I have nothing against doing work on the history of psychiatry in Egypt. It just wasn't what interested me, and I did find it very interesting that I was very often asked that question.